Welcome to PhD Hospitality's YouTube channel, a new platform for our team members to connect with news and information about the company and benefits offered. I'm Becky Nation, Director of Human Resources, and today we will be going over the team member benefit enrollment for OptiMed Health Insurance. Prior to joining me, you should have received an enrollment packet from your general manager, which I do encourage you to follow along with. Let's get started. So as you're looking at the first page, how does OptiMed Medical work? It's fairly simple. First, find a provider. You're going to locate a participating network provider, again, because it is more economical for you, because in-network providers do give discounts to people that are covered under OptiMed. You can call the OptiMed customer service at 1-800-482-8770 as well to get a provider or a local physician that is in network and does provide those discounts. You're going to schedule an appointment to see the doctor. Your benefit amounts will be paid based on the fixed schedule of benefits of the plan. Our plan currently offers two: the Value Care, which is a reimbursement of $50 per office visit up to 6 visits per calendar year, or the Preferred Care plan, which is reimbursed at $70 per visit up to, again, the 6 visits per calendar year. Assignment of benefits. If you do utilize an in-network provider, they normally will automatically bill OptiMed, and you'll just have to pay the out-of-pocket expense after the discount that is given. If you are utilizing an out-of-network physician, normally they will require you to pay up front, and then you'll have to send in a request to get reimbursed from OptiMed, which is fairly simple as well. It's just filling out some forms and sending in the bill. If you have any questions regarding this reimbursement, I do suggest you contact OptiMed customer service at 800-482-8770. Please note on these examples below, the in-network physician office visit could potentially bill you $100 for that visit. The OptiMed discount could range up to 20%. So in this case, this is an example. They're giving a discount at 20%, so that's $20 discount. The benefit paid is, in this case, at $60. In our case, it's either going to be a $50 reimbursement or a $70 reimbursement, depending on the plan you decide upon. Which means that in this case, again, the example only shows that your out-of-pocket is $20. If you look at the out-of-network side, please be aware that there is no discount given, and that's because the out-of-network does not have to provide any kind of discount to OptiMed clients. So the physician visit office bill is $100. The benefit payment, in this case, it's $60. In our case, it's either going to be a $50 or a $70, depending on your participation. So in this case, on the example, the out-of-pocket for the employee is $40. So looking at the examples, you can tell that the in-network physician is definitely a better buy. You don't have to come up with as much money out of pocket compared to that out-of-network physician. Again, a discount given for in-network physicians could range, in this case, it's up to 20%. It could be more than that. So please be aware of that when you do contact your provider or your doctor, and you might even get a quote prior to going into the office for that visit. So again, we've got two options under the OptiMed plan, and as you look at the summary of benefits on the next page, you're going to see we offer the two plans: Value Care Plan, Preferred Care Plan. One at the Value Care Plan is $50 per visit, reimbursement up to 6 visits per calendar year per person. And the $50 per visit emergency room reimbursement, sickness included in office visit maximum. So in other words, that's part of the 6 visits you can utilize per year. The wellness benefits, $150 calendar year maximum per person total, but it's $50 per visit. And then if you look at the X-ray outpatient and lab outpatient, there is a calendar year maximum, but it's $20 per day or $300 maximum per person per calendar year. These are very important to realize which area you will fall between. Is it the Value Care Plan or the Preferred Care Plan that's going to be best option for you? Again, the Value Care that I've just been discussing is reimbursable at $50 per visit, and it is a lower cost on a premium basis out of your pocket, But if you do utilize a physician visit more often and you see specialists, maybe the preferred care plan is the one you may want to choose, because that is reimbursed at $70 per visit. And again, $70 per visit for the emergency room. Wellness benefit is $70 reimbursed per visit. And the outpatient x-ray and lab moves up to $40 per day, $300 maximum per person per calendar year. So again, you have to utilize this information on the summary page in which to figure out which option is the best bet for you at this time. As we continue along in the summary of benefits, you'll notice that the hearing exam benefit is the exact same amount for both the value care and the preferred care plans. It is reimbursed at $70 per exam. This benefit is only good one time per 24 months. In other words, every 2 years is when this reimbursement is allowed. And the dependent spouse, and one time per 12 months per dependent child. As you look down to the emergency room, you'll see that this is a second emergency room. Please realize that the first emergency room was due to sickness, and that was reimbursed at a physician office visit amount. This emergency room reimbursement is for an accident. So this is for treatment in an emergency room if performed within 72 hours of the accident. And as you see, the value care is reimbursed at $500 per visit, but the preferred care is reimbursed at $1,000 per visit. Surgery anesthesia scheduled benefit indemnity, inpatient calendar year maximum per person, outpatient calendar year maximum per person, and anesthesiology. It's not applicable under the value care plan. It does have slight coverage under the preferred care plan. Again, this is a mini-med medical plan. It is not a full major medical, so this is where that comes into play. If you'll look at the preferred care plan, it's a $1,000 calendar year maximum for an inpatient visit, and 50% is paid of inpatient amounts. So 20% of surgical benefits are also provided if it's on the preferred care plan. Hospital confinement for bodily sickness and injuries. If it requires a 24-hour stay, it's payable from the first day of the confinement. In other words, when you go to bed and you're in the hospital. The value care is paid at $200 per day. Preferred care is paid at $500 per day. Intensive care is reimbursed under the value care at $200 per day, and the preferred care under $500 a day. There is a 30-day calendar year maximum per person for intensive care reimbursement. If you do need a skilled nurse at home, they do have a slight coverage for that. And in one case, the value care, it's $100 a day, and the preferred care is $250 per day. So as you continue looking at your summary of benefit page, you'll note that you have a small life insurance policy to include AD&D. That's accidental death and dismemberment. It is at $5,000, and it is included in both plans, the value care and the preferred care. Outpatient prescription drug benefit is OptiMed value care plan, $10 generic, and OptiMed preferred care plus plan is $10 generic or a $50 brand. Remember, the member pays 100% of the discounted price for drugs that are not covered under the OptiMed formulary. So the annual maximums for prescriptions are $2,500 for employee, $4,000 for employee plus one, and $5,000 for employee plus family. There are contraceptives that are covered under both the value care and the preferred care, and it is at a $50 copay, but it has to be in the formulary provided by OptiMed. So again, there are copays, but under the formulary that OptiMed sends out. So please make sure you have that information prior to going to pharmacies so you know what your out-of-pocket will be. Now let's go over the hourly team member benefit cost page that you have in your package. Please note that the premiums are effective the first pay period of the month that you are eligible for insurance. Only 2 deductions per month will be taken out. In regards to the health care, again, there are the 2 options, the OptiMed Health Value Care Plan or the OptiMed Health Preferred Care Plan. The Value Care Plan is the $50 reimbursement plan, and the preferred care is the $70 reimbursement plan. So the cost, as you'll see on the document or the benefit cost page, for employee only for the value is for $34.59. Again, the cost for the OptiMed Value Care Plan, employee only, is $34.59. Employee plus one is $59.08, and employee plus family is $79.81. This is per pay period for the first 2 pay periods of a month. Again, that is 2 deductions per month. If there are 3 pay periods in a month, that third pay period will not have a deduction. If you look at the OptiMed Preferred Care Plan cost, you'll see the employee only cost is $60.33. Employee plus one is $108.97. And the employee plus family is $149.06. And once again, that is per pay period. These amounts are pre-tax. It is under the cafeteria plan, which means you will not be taxed on the amounts that are deducted from your check for these health plans. If you have any questions in regard to that, please make sure you call Human Resources and we can discuss it further with you. Okay, so now let's look at the enrollment form for the hourly employees. I want to make sure that you complete your form correctly for all insurances. So please make sure when you are filling this out, you are putting the property name. That's the hotel that you're currently working at. If you want to decline the full coverage, you can check mark the decline coverage at this time, but you will also need to fill in the employee information with your name, social security number, gender, date of birth, address, and date of hire, as well as rate of pay, because I do not want you to not participate in the life insurance that the company pays for you. The type of request that is noted here would be open enrollment, and then you can mark under the plans which ones you would like to participate in. Dental insurance, vision insurance, health insurance. If you'd like to decline the health insurance, you will note on their decline. If you'd like to enroll in the health insurance, you would mark which plan you would like to enroll in, either the value care or the preferred plan. Again, dental and vision, it would be employee, employee and spouse, employee children or child, and family. So please be aware when you do complete these sections, if you are noting a spouse or children, you will have to complete section E. Under dependent information, you'll have to write the relationship, their name, social security number, date of birth, and gender. And then the final portion of the enrollment form is the signature, section F. If you are enrolling in the health insurance, you will be required to complete the enrollment form for OptiMed as well. Thank you for your time today. I hope the information in this video presentation was helpful and assisted you in making an informed choice on this benefit offered by PhD. We know how important benefits are to you and hope that we have provided a worthwhile benefit. If you are interested in the other available benefit packages, please feel free to watch the other videos on PhD Hospitality's YouTube channel. Thank you very much for your time today.